Welcome to our second segment on stress management. You probably should have already watched the first part of this segment before getting into this because it kind of establishes some of the things that are important to understand before we get into this discussion, but I do want to move on into this next part. So before you have already learned what stressors are, why our body responds to stress, how it typically responds to stress, the thing that I want to kind of point out before we get into this next segment is that the stress response is actually a normal and a natural thing for a person to have. It's actually a healthy thing. It can help you survive. It can help you be successful when it's managed in a healthy way. So that is our goal. It's not that we're going to avoid all the stress in our life. We will have stress in our life. The point is to make decisions and hopefully get to a point where we can kind of manage which things we get stressed about. And when we do get faced with stressful situations, learning how to manage that stress in a way that it can maintain at a healthy level, and how we can process that in a healthy way. So let's first of all talk about how our body reacts to stress. So we talked a little bit about what stressors were last time. Let's talk about how our body reacts to it. So when we're stressed, we can have allergy flare-ups. So if you deal with allergies, you might know what that is like, but you can even have kind of a heightened allergic response when you're under stress. You can have things like backaches, perspiration, which is sweating, okay, shortness of breath, hyperventilation, which is like just breathing too much, irregular heartbeats. You can have tightness in throat or chest. None of these things sound like they're too appealing, do they? You can have extreme fatigue. You can have muscle tension. You can have trembling. You can have muscle spasms. Acne flare-ups can be triggered by stress. Difficulty sleeping, okay, can be a part of dealing with stress. Headaches, neck aches, blurred vision, increased blood pressure, lightheadedness, constipation, diarrhea, upset stomach, and vomiting are all ways that our body reacts to stress. Stress, the nation's #1 killer. Medically proven stress contributes to a lot of things. So when we're talking about stress, we're not talking about incidental stress, okay, normal, everyday incidental stress. We're talking about a chronic stress management problem or a trouble dealing with stress in a chronic way. These things can lead to heart disease, strokes, high blood pressure, colitis, irritability, rheumatism, depression, migraines, diabetes, hardening of the arteries, insomnia, fatigue, sexual problems, skin diseases, allergies, overeating, asthma, kidney disorders, ulcers, breathing problems, and increased smoking. So stress can lead to a lot of issues, as you can see. If you don't know what some of those are, you're welcome to look those up. Emotional effects of stress. So there's not just physical stress, physical or medically proven effects of stress. There's also emotional effects of stress. So just feeling upset or having nervous feelings, feeling angry, feeling anxiety or fear, frequently criticizing others is another characteristic or common effect of stress. Frustration, forgetfulness, difficulty paying attention, difficulty making decisions, irritability, lack of motivation, boredom, mild depression, withdrawal, or even a change in appetite. These are all emotional effects of stress. You might recognize as you look through those that those might be, you might experience some of those when you feel stress, right? So it can kind of be helpful to understand where some of those things might be coming from. It might be coming from the fact that you're dealing with stress in your life. And those are kind of the ways that stress is manifesting itself in your behavior or in how you feel. Some of the physical effects of stress, it can cause an increase in stomach acid and can create or irritate ulcers. Okay, so increased stomach acid and ulcers. High blood pressure can lead to heart disease and disorders, so it can increase your blood pressure, as we looked at before, which can cause heart disease or heart disorders. It can lower the effectiveness of the immune system. So your immune system is designed to function at kind of like this balanced level, and when you're constantly stressed, it can make your immune system less effective. But you need your immune system to fight things off, right? And cancer or severe illness can occur. So those are just a few of the effects of stress. You need to be able to know what those are. Obviously, you can see how those would be detrimental to you. And so it's good to identify those. And then hopefully in the next segment, we'll be able to start talking about how to minimize some of these effects.